Hey, Jackie. We're going to start now.
And we're live. Hello, Tom Levecki here with the weekly edition of the Dr. Steinbrech Live
Yeah, baby.
Male Plastic Surgery YouTube channel. I'm dressed in gym attire, Doc, and there's a reason for it. Started working out again. If you guys missed it, I'll put a link below or above for the Anthony Lolly interview. Motivating. He said something that really stuck with me. He goes, "You want to die for your children, but are you willing to live?" So we are going to talk about a healthy lifestyle today, and then guys that do have gynecomastia. But before we jump in, Doc, how you doing?
We're doing great. Did some really awesome surgery today. Nice big 360 torso tuck. These Ozempic cases just keep on coming in, which is super awesome. So it's all really good stuff.
Did you hear it's to the point that like the junk food companies and the fast food companies, their earnings are taking a hit because of
Yeah.
Ozempic? I don't know if you heard about that.
No, you know the whole conglomerate, the Yum Yum people.
Yeah, yes.
So that's help me out, Tom. That's like Taco Bell. It's
Pizza
what
Hut.
Pizza Hut, and what's the third one?
I think Frito Lay.
Yeah, yeah,
Used
they're
to be
all
Pepsi, but Pepsi offloaded them because they were making so much money individually. And yeah, it's all bad stuff for you, which I guess keeps us in business, all right?
yep.
So today we're gonna jump in, and it's funny when I love doing this, and it's kind of morphing almost into a kind of a podcast in itself beyond the education. And I love hearing about your day, the cases, and that stuff. So a torso talk. I mean, God knows, how hard that is, and to come back on the podcast each week while you do this stuff is really exciting for us. All right, so let's jump right in. First question, Doc. Now we get questions for people, and we kind of clustered the five gynecomastia male breast reduction questions, kind of top five, if you will. So first question, Doc. Not that you have to credential yourself, but if people do want to know, what is your experience and expertise in treating gynecomastia?
Yeah, I mean that we've been doing it a long time, for over 20 years. So
Yep.
first learned how to do it at NYU, but I only learned how to do it the way they did it, and I realized once we started doing more and more men that there's a much better way to do it. We were just taught to do liposuction and make a couple of points and do it right there. And I realized you can hide the incisions. So there's a lot sneakier ways to do it over the years, and we've developed these techniques over the years to be able to do it. So been
Love
doing
it.
it for over 20 years, but where we are now in terms of doing it is much more sophisticated and can allow, and we'll get into this, but can
Yeah.
allow the patient to avoid unnecessary incisions. That is the way that we learned how to do it.
Isn't it kind of I don't say gray area, but a crossover to like plastic surgery versus maybe even a general surgeon, or is this generally the plastics wheelhouse?
I mean, it's plastics now, but you're absolutely right. It started out as like more of a general surgeon type of thing, and so there was not really sophisticated techniques, not clever techniques, not less invasive techniques. It was more like you have a problem that could be cancer, so we're just gonna whack it out, and
Yeah.
we're not those fancy cosmetic surgeons, so
Mm.
you're going to get what you're going to get, and you'll get the scar. And usually the resident was closing him up, which is adding insult to injury. But things have become a lot more sophisticated.
Well, this one's an easy one. Can you show us before and after gynecomastia procedures you perform? Well, I hope you guys got a lot of time. But with
Yeah.
that being said, we do have a plethora of gynecomastia cases to show you. So let's start off with this one, Doc. If you want to maybe touch on it, again, I look at the guy pretty decent shape, much better in shape than I'm in, but pretty decent shape. Give us kind of the strategy behind this guy.
Yeah. So we can go, and I have a whole, we call it the aesthetic ladder. I have a whole
Yeah.
ladder from very simple to much more complicated, depending on what we need for the patient.
Yeah.
but we can handle it. Even if it is a complicated situation, a scenario, we can do it. But the simplest one is going to be a guy that comes in and he's got just a little bit of fatty tissue that I can do remotely through liposuction alone. So,
Oh wow.
but I hide the incision. And you look on people's websites and you can see the incision right on the front of their chest. It's
Yeah.
crazy. You don't need to do that. So we hide the incision up underneath their armpit so that no incisions, no one would ever know. So that's the simplest form. But then sometimes people have a little bit of a woody tissue. So with that woody tissue, what you can do is make just a little nick incision, and then I can go in with teeny tiny scissors and snip it out, and that's what we call a clam strip procedure. Because as you pull them out, they look like little clam strips. So so the benefit of that is when you see some of these like gyno factories. Um, we do a lot of things for men, up and down, from the top of the head down
Yeah.
to the feet. But there's some people that are just gyno factories, and a lot of those people will automatically make a big incision underneath your areola and then take out the gland and throw it across the room for TikTok views. We don't do that. For 98% of our patients, we make a tiny little nick incision and we pull it out painstakingly through that little incision, so you don't have God help us, a problem with scarring, either hypertrophic scar or keloid. If you did, we'd make it much smaller. We completely hide that incision underneath the armpit, so it saves you from having that problem.
All right. So this is a little different case. Again, the guy doesn't look too bad. You
Yeah.
know what it is? You ever in a situation where like I can't think of a great example now, but just where like things aren't like if things are a certain way and you know nothing else, and then things get better, and you look back and say, "Holy cow, things are so much better." I didn't
Right.
realize how bad it was. You know what I mean?
Right.
Like I'm looking on the left, I'd pay for that, but then I look on the right and I realize, whoa, wait a second, that left is
Well,
not so great.
this adds on another layer, and you're exactly talking about what we're doing. How much technology and new procedures that we've developed has taken our results to new levels. So this is a patient that just comes in with gyno, but with using body banking or liposol transfer, grafting, borrowing some fat cells. It's actually a twofer because he can get rid of those bad love handles that he developed in his mid 20s, and then we can bank that into the upper inner chest. So you can see from the patient, not just taking out the gyno from the lower chest, but we think of it as a more comprehensive case aesthetically. So we're looking at the entire aesthetic unit. So you can not only, we don't think of this as like oh, man boob, doctor pull boob out of man. We think of this as an entire aesthetic unit. And for all these patients, we teach them very individually. But but instead of just pulling out that lower port, you also may have a skin component. Instead of cutting out skin, I can improve the upper pole that'll lift up the chest, give you more upper pole volume, good sexy male cleavage there. Looks
Yeah.
great in an open shirt collar with a blazer or in a V-neck cashmere sweater. Looks super sexy. And I can add that in with our body banging technique. So we can take, your Joe Blow gyno factory results, and we could take it to a new level, not only with smaller incisions or no incision at all, but also by using body banging techniques to give you an overall better aesthetic result to the entire aesthetic unit.
What about gyno reduction? Gynecomastia is essentially a
Yeah.
male breast reduction, correct?
Yeah, that's
Okay.
exactly it. But there can be also, see, if you've had it for a long time, it can stretch out the soft tissue envelope, the skin. So there may be a skin component. And if it really is a lot, then we may have to trim out that entire area and even do, for people who have had massive weight loss, for some of the guys that we've seen in some of these documentaries, we may need additional incisions or even to move the areola itself to be able to get it in a fantastic position.
Now, next question: how long does a procedure like that last before needing to redo it?
Yeah. Well, the gyno rarely, in my case, I think I had one case maybe 15 years ago, and it was just in a kid that was really young, and then he went on and continued to use steroids. So there was maybe a little bit of some of the tissue that was left over that regrew. But that was only one case in the last 15 years. By far, majority of the cases is a one and done. Once we remove it, it is gone. The only thing you might need to do later on is if the skin continues to fall with sun damage or just aging, is that we may need to lift up the skin a little bit. And we have a variety of techniques. We call it pectopexy. When I'm dealing with dudes, I never call it breast reduction. You're a guy, you don't
Yeah.
want to be. You don't want to be talking about a breast reduction. Breasts are for women. We're men. We don't do a mastopexy. We don't do a mastectomy like where you hear for breast cancer. For women, we do a pectopexy because you have pectoral muscles. So that's a pectoral area. So our whole verbiage that we use for men is completely different than women. So if you do need a skin lift later on in life, maybe 20 years later, we can do a pectopexy, and we have a couple of little tricks, Tom. One of it is take a little bit of skin around the areola, and then when we bring it together, that lifts the chest, so you don't have any other incisions underneath your on your chest. And the other thing I do, this is really sneaky. I go from the side and I do a lateral sweep that lifts up the entire chest, and we sneak the incision underneath your armpit. So that's
Wow.
camouflage a little bit of hair. No one sees that underneath your arm, so you don't have any problems with incisions directly on the chest.
Nice. Now we don't have this patient ask this question in front of us, but I figured I'd pick up a good before and after and use it as an example. So, what approach do you recommend for my specific case? So, this is a little more of an extreme case. You got some abs, you got bulked up a little bit, but what was your approach? This is a part I love. You looked at this guy to the left. Give us
Yeah.
like kind of your approach.
Yeah, he still had pretty good tissues. He did not have a significant lilt to the skin envelope. So for him, we were able. He had a little bit of a dip for his skin, but for him, because we did the body banking and the upper pull volume, and you can see post-operatively, he has a lot of good additional volume and good sexy
Yeah.
cleavage. That because we did the body banking, we were allowed to lift up his chest envelope so that we could just do the gyno without making any extra incisions there. So for him, all I needed to do was that little nick incision underneath the nipple, and you can also this is the other thing, you keep good nipple sensitivity, because whenever you take that whenever you make that incision, that I call it the smiley incision that a
Yeah.
lot of these gyno factories do,
The
they
anchor.
just do the same thing.
Yeah.
They bring you in, they undress you. Some of them do it just same day surgery. You walk in and they run your Amex card. You lie down
Mm.
on the table. They inject you, put on a little soap. Some of them don't even use. Frankly, they don't even use sterile gloves. But we're very thoughtful about our approaches. So, but we don't make, the point is we don't make that smiley incision. So most of them I'm just able to do just a tiny little nick incision right underneath the areola. And you're less likely with that smiley face. You're more likely possibly to have some problems with sensitivity of your nipple loss. And for most guys, it's important. Guys don't necessarily talk about it that much, but it's important.
Yeah. One question we got a lot is what are potential risk and complications associated with gynecomastia
You know,
surgery?
yeah, the good news is between the three centers, New York, LA, and Chicago, we do pretty much more men's plastic surgery than pretty much anybody anywhere else in the country. So,
Not the world.
if not the world. And so we do have good teams to help, number one, prevent bad things from happening, both in the
Yeah.
OR, but also post-operatively. So, but it is human tissue and things can happen. Most common things would be some delayed bruising, delayed swelling, um, uh, possible infection. I honestly really haven't had I haven't had a single infection for the gyno because it's such a limited area, and the blood flow is so excellent there. I put all my patients on antibiotics, 98% of them, and uh, it, really there aren't that many complications at all.
Nice. So, important question, because people obviously this person is very serious about it, so they want to know what is the recovery process like, and when can I expect to see the final results?
Yeah. Final results really gets out to be 8 weeks, 6 weeks to 8 weeks. You could go to the beach that weekend if you wanted to, but when you're not at the beach, we want you to wear foam panels and a chest binder, a
Yeah,
chest vest. The reason why we have you wear the panels is foam panels do such a good job of making sure that the tissues heal as flat as possible. And sometimes people they come to me and they've gone to another surgeon, and that's one of the things I ask: do they use foam
yeah.
panels? And a lot of times the answer is no. No, they just
Oh wow.
they laid me down, and they numbed me up, and they took it out, and there was a bigger incision, and then they just put on a chest vest, or even they just they slapped on some gauze, and then they put on an ace bandage, and that's it. And then the ace bandage rolls up, causes all kinds of lines and step off defects. So we find that if I put foam panels across the chest, then keep in mind the tiny little fat particles are still swimming around there, and there's inflammatory factors, there's healing tissue, lymphatics. There are a lot of things in that whole milieu, and we want it to heal evenly and flat. So we have 1 inch foam panels that does a lot of good stuff for it. People get back to work. They can go to work the same day. Sometimes people want to take
Oh
off
wow.
the rest of the week. Sometimes people want to take a week off. We can switch it to a more narrow panel if you want to get back to work. And then you can get back to the gym to work the lower body at the end of the week. If you want to do your upper body, we have you wait 2 to 3 weeks before you start working on your upper body.
So we probably do a separate show on. I think we should. Is Doc developed one version, working on the second version. Shouldn't say anything. And you're releasing a new protein shake or post
Yeah,
surgical
coaching.
shake because
Yeah.
you found out that when guys get surgery, and I don't want to steal your thunder. Give us kind of like why you
No, it's
developed
all
the
about.
shake.
It's really about carbs. Protein's
Yeah,
important, so we have a
yeah,
really great protein drink. But you need a lot of carbs to be able to heal up without any
yeah,
complications, right? And then also because so much of what I do is body banking, so we want to keep the beautiful cells in the upper inner chest to give that good, sexy cleavage. And as long as you have the carb drink post-operatively, I've noticed with my patients, clearly they're less likely to have a complication because they have good nutrition, and also they keep more of the body banking cells sticking around, so they have a beautiful result. And if those cells last, 3 weeks, really, we hold people to 28 days. They're there forever. They're not going to die. There's this sort of fallacy about fat grafting and body banking that if you um, that you can graft it, but then it kind of just wears away over years. No, it doesn't. If you get it in and it lasts 28 days, whatever is there, Mother Nature doesn't favor the other fat cells any more than this fat cell. If this fat cell survived, it's just as good. That little baby is just as legit as any other fat cell through the rest of your body. And interestingly, we should dedicate a whole show
yeah.
to like the intricacies scientifically of body banking. Is interestingly, those cells get bigger and smaller, but they won't die. So just as like fat on anywhere else in your body, when we bank it up in your chest, you'll have a lot of volume, probably in the wintertime. And then when you're like in your bulking, your dirty bulk phase,
Yeah.
then when you clean things up and get more defined abs for the summer, you may go down 5 pounds or even 10 pounds for the beach. You're going to lose some of your volume, but those cells will not die. They'll come right back next fall.
When you nice. All right, listen, Doc. This is a good one.
Yep.
Drop your link, drop your questions below, or we get a lot of emails, Instagram at Male Plastic Surgery. Give us questions that you have. Give us topics you want to cover. Doc is committed to this each and every week. He has not missed a week. And Doc, I'll give you the parting words.
Yeah, it's super excited. When you're thinking about gynecomastia, really look around, and you just definitely want to make sure that you're going to look at somebody that has non-invasive techniques, minimally invasive techniques, smallest incision, but then also other ways to improve your aesthetic results, not just yanking out the 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 breast tissue and throwing it across a room and slapping on an ace bandage. There's more to it, and you only want to do this once, because I do a lot of redos. So if you've
Yeah.
had, I hate to say the B word, botched, we've had botched gyno, I do a ton of that stuff. And that's probably like maybe 40% of what we do,
Wow.
are those cases. It ends up being releasing all the tethering, grafting things back in and making things look nice again. But you don't want to do that. You want to get it done right the first time. So make sure you do your research, look at a lot of before and afters. Go to somebody that's really dedicated and committed to men's plastic surgery. All right.
Doc, thanks so much for your time. See you all next
Thanks,
week.
Tommy. Bye, guys.